Welcome to the Dermatology ABIM review, where we explore key dermatological conditions and their clinical features. Pemphigus vulgaris typically affects those aged 40 to 60, presenting with painful, flaccid bulli and mucosal involvement. In contrast, bullous pemphigoid affects those over 60 with pruritic tense bullae, and it affects basement or hemidesmosomes. Skin biopsy is essential for diagnosis. Dermatitis herpetiformis is closely associated with celiac disease. It presents with pruritic erythematous papules and vesicles, often requiring a gluten-free diet for management. Lichen planus is characterized by the 4 Ps: pruritic, polygonal, purple papules, and plaques. Commonly found on flexor surfaces, it is associated with hepatitis C infection and may present with Wickham's striae. Urticaria treated with histamine blocker like loratadine. We add another histamine blocker steroid if no improvement. Allergic contact dermatitis can manifest as red, itchy skin lesions. Identifying the allergen and avoiding exposure is key to managing this condition. Keratoacanthoma appears as a solitary dome-shaped nodule with a central keratin plug. It grows rapidly, but often regresses spontaneously. Biopsy is crucial to distinguish it from squamous cell carcinoma. Systemic lupus erythematosus presents with systemic symptoms, while subacute cutaneous lupus erythematosus affects sun-exposed areas with scaly erythematous plaques. No other clinical or lab findings, as it's cutaneous only. Discoid lupus erythematosus features red, inflamed, disc-shaped plaques. It can lead to scarring alopecia and pigment changes, often triggered by sun exposure. Seborrheic dermatitis is linked to Malassezia yeast and is more common in those with Parkinson's or HIV. It presents with pruritic erythematous plaques, treated with topical corticosteroids and antifungal creams. Psoriasis and seborrheic dermatitis can appear similar but differ in plaque formation. Psoriasis features well-demarcated plaques, while seborrheic dermatitis does not. Psoriasis commonly affects the scalp, knees, and elbows, presenting with well-demarcated plaques. Treatment includes topical corticosteroids and vitamin D analogs. Generalized pustular psoriasis is a severe form characterized by sterile pustules. It can occur due to sudden steroid withdrawal and requires careful management. Gutted psoriasis presents with small drop-like lesions, while nail psoriasis features nail pitting and salmon patches. Both require specific treatment approaches. Let's go over the initial treatment of psoriasis, based on the type and location of the disease. Mild plaque psoriasis for limited disease, the first-line treatments are topical high-potency corticosteroids and topical vitamin D derivatives. Moderate to severe plaque psoriasis. When the body surface area involved is greater than 10%, systemic therapy is often needed. Options include phototherapy, systemic therapy such as methotrexate or biologic agents, facial and intertriginous psoriasis. Because these areas are sensitive, avoid high-potency steroids. Instead, use topical tacrolimus low-potency corticosteroids. Finally, guttate psoriasis. This form often follows a streptococcal infection and may resolve spontaneously. Treatment options include observation with no treatment in mild cases, phototherapy, topical corticosteroids and vitamin D analogs. Pityriasis rosea begins with a herald patch, followed by a Christmas tree pattern of lesions. It's self-limiting, but may require phototherapy if severe. Sweet syndrome, also known as acute febrile neutrophilic dermatitis, is characterized by painful, erythematosus lesions and fever, often following infection or drug exposure. Steroids are the primary treatment. Leukocytoclastic vasculitis presents with palpable purpura, often on the lower extremities. It requires thorough evaluation to determine the underlying cause. Necrobiosis lipoidica diabeticorum often precedes diabetes diagnosis. It presents with yellowish-brown lesions and requires high-potency topical glucocorticoids for treatment. Senile purpura results from chronic sun damage, leading to fragile blood vessels and purpura. Management focuses on sun protection and avoiding corticosteroids. Exploring the impact of medications on skin conditions. Warfarin can lead to a rapid decline in protein C, causing a procoagulant state and skin necrosis. This condition often affects the breasts, thighs, buttocks, and abdomen, requiring immediate cessation of warfarin and possible vitamin K administration. Certain medications like imatinib, sorafenib, and sunitinib can cause hand-foot skin reactions, characterized by redness and swelling. Dress syndrome is a severe drug reaction involving eosinophilia, lymphoptosis, and liver enzyme elevation, and systemic symptoms, often triggered by anticonvulsants and antibiotics. It requires careful management and supportive care. Managing rosacea involves avoiding triggers, using sun protection, and applying topical treatments. Laser therapy may be considered for persistent cases. Porphyria cutanea. Tarda presents with blisters and hyperpigmentation on sun-exposed skin, often associated with liver conditions like hepatitis C. Stevens-Johnson syndrome and toxic epidermal necrolysis are severe skin reactions often triggered by medications, requiring immediate medical attention. Treatment for hidradenitis suppurativa varies by severity, from topical or oral antibiotics, biologics, retinoids, to surgical excision in severe cases. Environmental factors can significantly influence skin health, leading to various conditions. Miliaria, or heat rash, presents in different forms, from small vesicles to erythematous papules, often due to blocked sweat ducts. Allergic contact dermatitis results from skin contact with allergens, causing inflammation and irritation. Calciphylaxis is a painful condition in ESRD patients, characterized by calcific uremic arteriolopathy, often requiring aggressive treatment. Infections can manifest in various skin conditions, each requiring specific treatments. Erythrasma is a bacterial infection presenting as red-brown patches, often in skin folds, treatable with topical antibiotics. HPV can cause common warts, treatable with salicylic acid and cryotherapy. Secondary syphilis presents with a maculopapular rash, often on palms and soles, requiring antibiotic treatment. Coxsackie virus causes hand, mouth, and foot disease. This disease presents with fever and sores, primarily affecting children. Rash hand and feet aren't painful. Tinea corporis, or ringworm, is a fungal infection presenting as red, scaly patches on the skin. Tinea versicolor is a fungal infection causing discolored patches on the skin, often treatable with antifungal medications. Scabies, caused by mites, presents as itchy rashes, with crusted scabies being a more severe form. Erythema multiforme presents with small, recurrent, painful blisters, often due to viral infections, while Lyme disease can cause a bullseye rash. Erythema nodosum is characterized by tender nodules and can be associated with inflammatory bowel diseases like ulcerative colitis. Pyoderma gangrenosum is a rapidly progressing, painful ulcer with violaceous borders, often linked to inflammatory bowel diseases such as Crohn's and ulcerative colitis. For hyperhidrosis, treatments include topical aluminum chloride, iontophoresis for palms and soles, and botulinum toxin injections to block nerve signals. Pyogenic granuloma is a benign skin tumor that bleeds easily, often appearing as a small reddish bump on the skin. An epidermal inclusion cyst is a small, benign bump under the skin, often filled with keratin. Dermatofibroma is a common benign skin growth that feels firm and is often found on the legs. Seborrheic keratosis is a common, non-cancerous skin growth that can appear anywhere on the body, including the ear. Livedo reticularis is a skin condition that presents as a mottled, purplish discoloration, often linked to cholesterol emboli. Alopecia areata is an autoimmune condition causing hair loss, often treated with intralesional corticosteroid injections. For onychomycosis, the first step is a KOH nail scraping, followed by oral antifungal treatment, with local treatments for mild cases. Squamous cell carcinoma is a common form of skin cancer that appears as a red, scaly patch or nodule. Basal cell carcinoma is the most common type of skin cancer, often appearing as a small, shiny bump or nodule. A venous lake is a small, dark blue, benign lesion often found on sun-exposed areas like the lips. In patients with vitiligo, it's important to check for other autoimmune issues, such as thyroid disorders.